Now, other than the ASEAN Summit, we also would like to focus on matters concerning health. Last week, the World Health Organization voted in favor of a global treaty on improving pandemic preparedness. While this is a landmark decision, the pandemic also highlighted the need for Malaysia, along with ASEAN, to reduce reliance on big players and build greater self-sufficiency in medical research and development. Astro AWANI correspondent Faye Kwan reports from Australia's National Science Agency in Melbourne.
Malaysia aims to create its own homegrown vaccine by 2030. Now that's outlined by the National Vaccine Development Roadmap. This is, of course, supported by Australia's National Science Agency in terms of manufacturing infrastructure and human capital, as well as know-how for the advancement of the vaccine. Now, earlier I spoke to Professor Susie Nielsen from the National Science Agency, also known as CSIRO, on the significance of this partnership and the importance of developing self-reliance within the biotech industry for the region.
So I think if COVID taught us something, it taught us that we rely on accessing both the components for medicines and medicines from a limited source around the world. And when something like a pandemic completely disrupts the supply chain, you realise just how fragile that is. So by developing our capabilities to actually manufacture things in multiple different areas and being self-reliant within Southeast Asia, it negates that reliance on a very small supply chain. So as mentioned, traditionally medicines are often manufactured in a small number of countries. India and China are very good at doing that. But when things impact and you can no longer access that, we realise that we have a bigger problem. So if we can develop our reliance on the Southeast Asia region and work together and collaboratively build those expertise and that ability to have self-reliance, then when a new pandemic or epidemic comes, then we won't be relying on a very few other organisations or countries to actually help us to be treating or prepared for that.
Malaysia currently imports 100% of its vaccines. CSIRO's collaboration with the National Institutes of Biotechnology Malaysia aims to improve access to affordable, high-quality medications and strengthen regional health systems ahead of future outbreaks. This involves providing tools and hands-on training for Malaysian scientists to advance vaccine candidates through quality control and clinical trials.
So the significance of developing a vaccine in Malaysia, it allows sovereign capability for Malaysia, and it also allows to have a healthier Southeast Asian region, because if we think about Southeast Asia, there's an equivalent population in that region as there is to Europe. And yet at the moment, in terms of manufacturing vaccines or therapeutics, that's just not available. So if we can grow the region so that there's more opportunity to manufacture vaccines, then that will provide equitable access and access to new medications within the region on an ongoing basis.